Hi, my name is Matthew Elizondo. I am a physical therapist and I'm the clinical director of Spero Rehab here in South Austin. We are a physical therapy clinic. So the name of the career is physical therapist. Um, I got interested in physical therapy because I was interested in working with people. I was interested in movement and kind of how the body moved. Um, so when I was younger, I played sports and worked with some of my friends and colleagues who had injuries and they went through physical therapy to get better. My grandpa also had Parkinson's, and as he went through his Parkinson's diagnosis, he worked with a physical therapist, which helped improve his function, and so that's what kind of really sparked my interest in physical therapy. Um, what education or training is needed. So you would go to um, university or get your undergraduate degree. You can major in anything you want as long as you fulfill prerequisites required for graduate school. So after 4 years of undergraduate school, you would apply to physical therapy school, which is a doctorate, a clinical doctorate. So there's grad schools, all over the nation, and then you would apply there. And once you got accepted, you would go for an additional 3 years. So you have 4 years of undergrad and 3 years of graduate school. And so that'd be a total of 7 years. After you graduate, then you would take the licensure test, physical therapy board examination. And then if you pass that test, you become a licensed physical therapist. At that point, you can get post-professional training and specializations. So you become specialized in sports physical therapy, orthopedic physical therapy, um, neurological physical therapy, um, anything like that. If you wanted to, if you wanted to become specialized, but you could still practice with just a license in physical therapy. Um, where are some good schools for this field of study? So there are a lot of good schools all over the nation. That you just want to make sure that they're accredited. Every school is a little bit different. With some schools are accelerated, so they may only take 2.5 years. Some take 3.5 years. Um, so I would just research to see kind of faculty they have, um, what is their pass rate for their licensure test. But there's a lot of good schools out there. The hardest part about physical therapy is getting into grad school. It's very, very competitive. It's very enticing. It's not as long as med school if you want to become a doctor, and you can do a lot of things with it. So you can treat a variety of different things. Description of job activities. So as a physical therapist, we are experts in musculoskeletal disorders. So, when somebody comes in with a diagnosis or an impairment, we do an evaluation. So based on our evaluation, we find impairments or things such as weakness, balance deficits, decreased range of motion, mechanical issues with a patient that can be coming in for a variety of things. So sometimes it's an athlete, sometimes maybe it's an older patient who's just trying to learn how to go up and down stairs or just walk. Sometimes it's after a surgery. It's a lot of different things that what we're doing is kind of helping them teach their body on how to move and how to feel better. So we do that with an evaluation, and then we set up a treatment plan to give them interventions, which can range from a lot of different things. Certain exercises, using certain equipment, hands-on therapy like manual therapy. Um, we work in different types of settings, things like that. So once we put them on a plan, depending on where they are, we kind of phase that plan into a progressive, improvement. So a patient might not be able to tolerate a whole lot at the beginning, but we're trying to get them to achieve their goals, whatever that may be. And then we discharge them and send them on their way once they've achieved those goals. So a potential salary for a physical therapist, there's a big range depending on experience and what setting you're in and what geographical location you're in. So usually the range is anywhere from 60,000, but it could definitely go up to six figures, 100,000 plus, depending on the setting. Like I said, what location. If you're in an area that really needs physical therapists, they're going to pay you more. If you're in a environment that needs, or a clinic that needs a physical therapist, they're willing to pay you more. Things like that. And then also leadership positions. Like once you become a physical therapist, if you want, you can, become a manager for a clinic or a director. You can own your own clinic. So the potential to make more is there if you, go up the business side of things as well. Advantages of this career: a lot of, flexibility. We're not on call on weekends usually. We have a pretty straight, flexible schedule. You get to help a lot of people recover from, anything that they're going through, pain. Maybe they sustained an injury or had a surgery. You're helping them. You're improving their life, their quality of life. So this is very satisfying that you help them or enable them get to where they want to be. You spend more time with patients usually than maybe some other healthcare providers. It's very, very flexible. You can work in a school setting. You can work in an outpatient clinic. You can work in a hospital. You can work with sports teams. There's a lot of different areas that you can work in as a physical therapist. So there's a lot of variety if you want. And it's growing. It's growing. You continually learn new interventions, new techniques. So it's a career that increases your knowledge as you gain more and more experience. Disadvantages of this career: I think we could all agree that working, with a patient and working with people is very, satisfying. But the disadvantage is the documentation. So when you do something with a patient, you have to document it so that you can provide that to the insurance companies or to the doctor, to the referring provider, or just for the patient's records. But documentation sometimes can be tedious. It takes time away from the patient. So that's a slight disadvantage is doing the documentation. I'm very passionate about physical therapy. If you guys have any questions, we're always taking volunteers. And so, yeah, it was very nice talking with y'all. And thank you.